All right. Well, thank you very much, Kate and Caitlin. I appreciate you guys doing the introduction on this. I think this is going to be hopefully an enjoyable topic to kind of explore and talk about. I really hope at the end, too, when we start open up the forum for people to discuss, it'll be one of those topics that people want to share about, because I think vulnerability is about kind of sharing and exposing some of the challenges that we deal with when we're trying to connect and make relationships with our patients, especially in the healthcare industry, and how that can be, tricky. I think all of us get into this field because we want to be able to help people. But then we have the challenge of, what is the right boundary? How far do I go? What do I share? Is it for the patient? Is it for myself? Those kind of questions. But first and foremost, when I was, looking at this topic of vulnerability, I thought, for me being a counselor, one of the most kind of important things about vulnerability is that it's a necessity of wellness when I'm doing therapy. Like, the more vulnerable somebody can be, the more I think we can get to kind of the heart of the matter. But then I thought, okay, well, what does vulnerability mean? And so I started I start this presentation with kind of looking up definitions of vulnerability, and I found out that it wasn't that term isn't looked at as maybe as positively as I perceive it to be. Because when I looked up the definitions for vulnerability, it said things like, being susceptible to physical harm or damage, being susceptible to emotional injury, especially, being hurt, being susceptible to attack, open to censor or criticism. And I'm thinking, well, those aren't really, positive terms. As I'm thinking of a vulnerability in the title of this presentation, The Power of Vulnerability, it kind of makes you think of, like, if I'm vulnerable, I'm very much at risk or in danger. In fact, looking up even more about vulnerability and what it's like to be vulnerable as a physician, some of the information I was kind of came across was that it is perceived as a weakness. That the more vulnerable I am, the less strength I show, or I'm not as sturdy as I need to be to do this profession. Physicians are trained earlier to have higher expectations put on them, that, being emotional, being vulnerable, kind of that interpersonal connection is sometimes exposing things that are sometimes, sensitive, with people either sharing themselves or, finding a way to let people share with them through kind of emotional empathy and genuineness. Is not always looked at as a positive. It's more, sometimes the idea in the physician world is almost more robotic. The vulnerability is associated with words like helpless, defenseless, powerless, weak. That's not what I view vulnerability as, but I know that that's kind of how those words are kind of viewed societally, especially in a profession where we're expected to have answers. People come to us because they are vulnerable and they are concerned and they need an answer. But, part of that answer is also being connected with, especially when they are feeling scared. Or defenseless or powerless, and being able to allow ourselves to be like with them on that. The thought of vulnerability, the thought that vulnerability hurts patient care, that in a physician's own well-being. There's an idea out there that when I was looking up as it relates to physicians, that if I'm vulnerable with my patients, then it's going to hurt them. That it's not going to, that they'll have less respect for what I'm going to share with them. And it also hurts me because it allows me to, if I'm vulnerable with them, I won't be able to handle that. And that's kind of the last point there, is like, if I was really vulnerable and genuine with all my patients, I would just be overwhelmed. I wouldn't be able to cope, and I wouldn't be able to deal with stuff. And I do agree that there's a certain level of how far do I go being vulnerable, and what do I share and what do I not share, and we'll talk about that as that presentation moves along. But the idea is, the things that I read and the statistics I found would suggest that that's not the case. That vulnerability and being vulnerable with patients to healthy degrees allows for better patient care, and it also motivates for us as healthcare providers more motivation to look for answers for people's problems that they're coming in with. And so the question really came up when I was looking at it, is like, what happens when we lose our ability or become intolerant to being vulnerable? And so I'm going to start this off like I do with some of these things. I have a little bit of a video presentation. This is from a leading expert on vulnerabilities, but as well as vulnerability with the physicians and vulnerability. But this is just kind of from a talk she did just on the general nature of vulnerability and what happens when we lose our vulnerability. So just have a couple minutes just to kind of talk about have this as something that generates some thoughts, and then we'll kind of go more into hopefully talking about, instead of this idea of negative, this negative vibe about vulnerability, we look into what vulnerability really brings to us.
And in our culture, what do we think is synonymous with vulnerability? Weakness. You are an excellent audience. It's almost as if I trained you. It's perfect. Weakness. And I'm going to talk about how that's not the case tonight. Vulnerability is absolutely at the core of fear and anxiety and shame and very difficult emotions that we all experience. But vulnerability is also the birthplace of joy, of love, of belonging, of creativity, of faith. And so it becomes very problematic when, as a culture, we lose our capacity to be vulnerable. So this kind of fatalistic car crash is a symptom. I refer to it as foreboding joy. One of the symptoms that we're losing our capacity for vulnerability is that joy actually becomes foreboding. Something good happens, or we're looking at someone we love, or we're thinking about something we care about, and then we become compelled to beat vulnerability to the punch. Other symptoms: disappointment as a lifestyle. It is much easier to live disappointed than it is to feel disappointment. And so this is the person in the after-school movie that, I don't want to play your stupid game because it's dumb and boring, and because really maybe nobody will ask me. We sidestep getting excited about something because we're not sure it's actually going to happen. Low-grade disconnection is another symptom of vulnerability avoidance. We go through the motions. It's like low-grade fever. It may not kill us, but it keeps us pretty miserable. Perfection is one of the, I call it the 200-pound shield. How can anything go wrong if my life looks like an ad? I'm going to perform and please and make sure everything's perfect. And perfectionism has nothing to do with striving for excellence and healthy. It's nothing to do with healthy striving. People who I interview who are absolutely accomplished and people who strive for excellence are the biggest negotiators and compromisers that I've ever interviewed. Perfection is a tool to protect ourselves. Extremism. There's a very simple equation. Faith minus vulnerability equals extremism. Faith is the vulnerability that flows between the shores of certainty. Faith without vulnerability, spirituality is inherently vulnerable. It is believing in things we don't understand or really can't see. And last, I believe the most universal way that we are dealing with an intolerance for vulnerability in our culture is that we numb. And I'll talk about this in a minute.
So I just wanted to kind of put that, that video on there just to kind of, talk about some of the things that happens when we don't allow ourselves to be vulnerable. And I think some of the points that were really kind of important in the little clip that I kind of showed was this idea: if we don't allow ourselves to be vulnerable, like, we lose joy. We become, we start living in a kind of a world of disappointment. We allow ourselves to just be expecting disappointment. We have disconnection from people, and I think these are things that, like, when we talk about, I'm thinking about physician wellness, and the things I deal with on a day-to-day basis is stress and burnout, and people just becoming overwhelmed with their job, don't know what to do, feel like they're, don't have any help, can't do what they want to do, and can't connect the way they want to. I think these are real issues in the healthcare industry. Like, people feel like they can't connect. And when they can't connect and they don't give them time to be vulnerable, they lose the joy of what they want to do this for. And so one of the things that we want to talk about is, even though we can't change some of the maybe systems in place that kind of remove us from being able to connect the way we want to, how can we take advantage of the time that we have and really be able to maximize the relationships we have with what we're given to work within, so we don't lose the joy, and that we become more excited and more willing to connect and share and be with our patients. That they come in and they're not only getting the care they need from your expertise, but they're getting the care they need from that human experience. So Dr. Brown, the person just did that presentation, talks about and defines vulnerability as the courage to be imperfect and the compassion to be kind to yourself and others. And I think that's a powerful statement. That courage to be imperfect, the courage to just be human. And I know that's kind of a difficult thing in the medical world. Like, there's a part of us that we have to be, on our game and do what we need to do, and so the person's able to get the right health care that they need. But they're also part of being able to be, I think the right word is vulnerable, and not imperfect towards the job you do, but kind of being able to be human, and connect and or sometimes like just be there without always having to immediately kind of present as this is how we do it, this is how we do it, but just sometimes sit with a person when they're struggling with the information. We want patients to be transparent, and so it's great when they get a chance to see our human side. It allows them to create trust, which is the next point. Like, vulnerability is deeply connected with trust. When somebody feels like they have somebody connected with them, they're more willing to trust and do what's being asked of them. I can tell you my experience doing this job is that's why there's techniques and skills and behavioral modifications and education towards all kinds of healthcare issues I deal with, like depression, anxiety, addiction, PTSD, all those things. They have tangible things that can be done and treated with. The thing that helps people the most to be willing to do that is having rapport, having trust, and trust is developed by that connection of being vulnerable, about being human, about being genuine. That we're here together, not before anything else, you're here because I am this, profession or this title, but I'm also human. Part of the connection is if I just need to get fixed, I get checklist and just here's the answer, but that's not how it works. Part of what connects people and wants them to come get help is connecting with somebody else to help understand what they're dealing with. Patients' trust produces better compliance and better outcomes, which is what we're all looking for, right? We're all measured by the outcomes that we do and satisfaction. So creating that vulnerability is good in being able to get the outcomes that we're looking for. And it improves a physician's ability to kind of understand and connect with patients. People, when they're being vulnerable and allow themselves to kind of join into that person's world, you become more like aware and in tune to the sensitivities that they're dealing with. And to me, that's really important, because knowing that patient, knowing how to connect with them, and being able to, maneuver, talk in a way towards their vulnerabilities helps them want to be able to share more or have better trust. And they see that. They see that you're understanding them. I like this kind of information, this quote from this article that I picked out. It says, recognizing similarities between their own life and the patient's story. The doctor said that they would identify more closely with the patient's perception of the problem and increase their capacity to search for solutions. The more that a physician can connect and become part of, the more they're willing to be part of the solution. More finding other options, finding other things. And not saying that every case is like that. It's all complicated, but some are. And being able to spend time in connecting on that human level not only motivated the patient, trust and compliance, but it also motivated the physician. But like anything, there can be roadblocks to vulnerability. This uncertainty of how much do I share, how far do I go? We all have professional boundaries we have to keep in mind when we're exposing stuff, and our own personal insecurities about vulnerability, which I think is kind of this three-pronged thing. We have, I don't know, where to go, what do I become vulnerable with? I have rules around this, and then I have my own insecurities, my own kind of personal hang-ups on this stuff. And I like this quote from an article I found. It said, it felt dangerous You fear the risk of losing esteem from the patient. It also somehow it is also somehow taking a chance the patient might use that against you, or misunderstand it, or spread it around. And that is a risk if I'm going to be vulnerable, if I share something that kind of trying to help motivate or push that client to different places. It is kind of risky, and that is, a lot of us don't want to put that out there because we don't want a backlash. But at the same token, we want to sit there with every patient we get and be able to maximize their wellness. And so it can be complicated. Those kind of questions can be complicated. So the tips that we kind of talk about in doing something like that is, make sure you know your patient, and know the goal of vulnerability. Like if you're sharing and kind of exposing something to a patient that they might be able to, if they have that information, may feel like it come back again. Just know the patient, know what's the goal. If I'm going to share this with you, and know the goal is also about moving the patient forward, not like I just need to put this because when I hear you say this, it triggers something in me, and I just, I need to share that. Is that it's something that's going to push them forward, and help them beyond just what your expertise in medicine is. And then also kind of know, what you share is vulnerable to be exposed, and that you're okay with that. This is kind of really a complicated thing. I work with physicians in addiction. And I have many of my clients that after they've established recovery, they become more understanding and more empathetic towards addiction in the ways that they weren't before, having their own personal experience. And so they find themselves, especially some family physicians or primary care physicians, they're having patients come in and they're struggling with that. And one of the tools that they've used through getting comfortable is to say, I struggle with this as well, and this is something this is what I did to get help, and here's some other options. And that's a big risk because some of the people we're working with are at that point, confidential. They're utilizing the high one bite rule, and they put it out there. That patient can take that anywhere. I was hoping to have one of those physicians kind of share some of this presentation, but they weren't able to be part of this talk. But the feedback I got was they haven't had that problem. In fact, they've helped motivate people into trying something they wouldn't have done before because they looked at that physician in that position of power, and seeing that vulnerability let them say it was okay for me to be struggling with this too, and maybe there's hope for me. Just a couple other little thoughts, that are kind of with this creating compassion and empathy and creating this vulnerability, is that, patients want to know a doctor is compassionate and empathetic as well as medically knowledgeable. I would say it's pretty equal. I know that from my own personal experiences that I want that expert, but I want somebody that I feel comfortable with, because I know that at some point, especially when I'm creating that primary care relationship, that I'm probably gonna have to talk about something that's like, in my own personal insecurities, a little awkward or something I don't want to talk about. And I want to know that they're okay with that. They're compassionate, that they understand, and that they're are with me on that. And sometimes even to say, yeah, I've had similar, it was uncomfortable when I had to deal with something like that, and make me feel that it's okay. Now, once that's established and it feels okay, then it's much more open to hearing what the direction is that I'm given. Authenticity is what's most important in the physician-patient relationship. That's what Dr. Brown, during her research with physician vulnerability, just found out that it's the critical. It is what's going to carry this relationship, especially in a kind of a family practice or primary care, the ongoing. It's that relationship that's why people come back to see them, because they feel connected. And so this ability to be vulnerable and be human is really, really critical. And it's a strength. It's an asset, not this, this thing of weakness. I love this quote from Dr. Osler, I'm probably mispronouncing that, said, "It's much more important to know what sort of patient has a disease than what sort of disease a patient has." And I thought, wow, what a great quote that is. This idea that this disease isn't the primary thing. The patient's the primary thing. The patient has something they need treated, but this is where I'm at. I'm connecting with this person. There's something because I have an experience or expertise in doing so, can help treat them, but they are first. They are not that diagnosis. They are this person that happens to have this diagnosis. And I think that's that mentality of, and that's a big challenge for me sometimes too, because I can preconceive things with complicated kind of mental health issues that say, oh, I'm going to have these and this, and looking at the symptoms rather than the person. The person's what I'm looking at when treating, and the person's what's going to make my recommendations or directions work. And if I don't know them and their abilities to kind of, what their strengths are and what are maybe some of the challenges they have in being compliant with stuff, I'm probably not going to have success. So I need to know who that person is. And a couple more just kind of tools of being vulnerable. I think, these are just in general tools of vulnerability, but I think they can be applied into like personal practice as well. It's this idea of like, we really want to be vulnerable. We really want to create that experience of joy, of love, of connection. We have to learn to be real. I think I've used the word genuine several times like this, and that word's a big word for me because it's one of those key words that we have when we're, I've done a couple counseling degrees, is that genuineness is critical in creating a relationship of wellness. And then, don't act in a world of guarantees. Don't be in this thing where I need to know the answer to this situation. If I take this risk, this is what's going to happen. Take risks regardless of what the outcome might be. I'm going to sometimes be vulnerable and see what happens. I may not get what I think or hope, but I'm going to put it out there. Ask for help. Be okay with getting rejected. Sometimes we put it vulnerable and we put something out to, I've done that before when working with people. I've put something out there that I thought would be helpful, that was kind of like personal. I've been through a divorce and somebody's struggling with that. I may have shared something like, yes, I know it's, I've been, and that wasn't received, and it's okay. That's okay. That wasn't, and sometimes it's okay to know that I took a risk. It wasn't what's needed, and then kind of learn how to move forward from that. And understand, and it says embrace negative emotions. Like sometimes one of the things, and she talked about at the end of her presentation, is there's this need to escape or, numb out feelings, and it's okay. Negativity is a good thing. Knowing emotion and how being vulnerable and not maybe being received and feeling sad or feeling angry or those are okay. Emotions are fine. Emotions are never a problem. It's how we respond to emotions, the behavior that we empower emotions to have. We're supposed to have emotions because they're good meters to kind of help direct us towards situations. But a lot of times we get caught in emotion and just let them dictate our behavior instead of saying, okay, this is teaching me something. And it's okay to experience negative emotions and being vulnerable because it will happen, and that's okay. I think I wanted to kind of just conclude with another short snippet from the same presentation, kind of her concluded piece. It's just a little extra, it's about a minute or so, and then we'll kind of maybe move into talking. And I think one of the things I'm trying to do with this vulnerability is kind of talk about the topic and share a little bit of the kind of concepts and ideas about vulnerability and why it's important. But I think more importantly will be when we get done is hearing you guys share your experience with vulnerability and with patients and how that's been, or being vulnerable. What are some of the concerns or the perceived worries of vulnerability in the world of medicine, especially in primary care and family physicians. So I just have this, and we can maybe have some time to talk afterwards.
So the question becomes, how do we embrace vulnerability? And here's what I learned from the research. We practice gratitude. We stop and be thankful for what we have. I've interviewed a lot of people who have been through many horrific things, from genocide to trauma. And when you ask them what they need, they will tell you, I don't need your pity, I don't need your sympathy. When you look at your children, I need to know you're grateful. I need to know that you know what you have. So to practice gratitude, to honor what's ordinary about our lives, because that is what's truly extraordinary. We can compete with the images from the media, from the news, from the scary shows on TV, with our own images of gratitude about what's ordinary in our lives, the people we love, our kids, our family, play, our community, and nature. These are things that happen every single day that we're so busy being afraid we're missing these. So that's, I think, the biggest thing, is to be grateful for what we have, to honor what's ordinary. And last, I just want to say that, and I'm a parent and I'm a vulnerable person too, but I really believe, we want more guarantees. We want to believe we're not going to get hurt and that bad things are not going to happen, and they are. But there is a guarantee that no one talks about that, and that is that if we don't allow ourselves to experience joy and love, we will definitely miss out on filling our reservoir with what we need when those hard things happen.
And so, I think that final point of talking about this is like, we're talking about vulnerability in a lot of different kind of ways. We're talking about just the generalization or general idea of vulnerability, and then we're talking about what it's like to be in the kind of position of dealing with vulnerability, and then expecting that from our patients and what we give to our patients and what's kind of appropriate, how far can we go with that kind of stuff. But the real thing, and I like that she ends on that kind of note, is like, when we take these risks, we just got to be willing to just go places that seem uncomfortable, sometimes connect deeper with people, and not expect that I have to know what that's going to lead to, and just be open to the experience, that I'm going to take a risk, even if it feels like that's not what I'm supposed to do, or that if I feel like it's going to help somebody get better. And I think one of the things to talk about, especially when we're talking about like vulnerability towards, as being a practicing physician and stuff like that, is that when we connect and help people get better, that creates such satisfaction and joy in our work. So I think that's one of the challenges there, is being able to say, by doing these risks, it'll make me feel more connected to what I do. And I think that's one of the things that'll help us reduce the stress and burnout, is being able to say, I'm going to let my humanness be a more strength to my practice, even as equally as what my knowledge is in medicine. So anyhow, I have I asked a couple of questions like, what does vulnerability mean to you as a physician, or the risk of being vulnerable, or the rewards of being vulnerable? And those are some questions we can maybe talk about. But I, really open up the avenue for these last, 15 minutes. Just kind of share your guys' experience with vulnerability, or the questions about vulnerability, or just, connecting with other professionals about vulnerability. I have some resources that's on that last slide, just books or apps you can look at it for more information on vulnerability, and some articles. But I'll kind of allow this last little bit of time to maybe hopefully have some discussion and talk about vulnerability.
Hey, Nelson, thank you so much for guiding us through that important topic. One of the questions that's come up is, I think you've mentioned in an article that appeared in our Family Medicine Update that there's 3 golden rules to opening up to patients and colleagues
Sure.
for physician wellness. Could you kind of touch base on those quickly?
You mean as far as and I'm not sure if I saw the article that you're talking about, but I mean about what I presented here about this kind of things. Yeah, absolutely. I mean, the points that I kind of found when I was looking at this stuff is that those kind of 3 rules about being vulnerable are A, know your patient. Like, who is the person I'm going to kind of expose it? Because some patients, and I know this in my own world of working with people, aren't necessarily looking for it. I mean, I think most people are looking for a connection, but there are definitely people that's not something that they're coming there for. So knowing the patient, or knowing what the patient, or the patient's history and what they may do with a vulnerable piece of information. And then the second part of it was, what's the goal of my vulnerability? I think that's something that I know that I have to practice all the time, is if I share something, that goal is not for me to feel better, or it's for the patient to feel like that's a tool that they can use to help motivate them to move further. Like, that will be a piece that will help them say, okay, I have hope, or there is a way to get out of this, or this because I've seen this experience, that I know that I will be more willing to be compliant to the direction that I'm giving. So what is the goal? The goal is directed towards, and I think we talked about that in boundaries, it's goal oriented and directed towards moving the patient forward. And the last one is knowing and being aware when I expose something that may be vulnerable, may be sensitive. If I've had for me, the experience I've had the most when I'm working with physicians is that they've been vulnerable about sharing, having a diagnosis, if it's a mental health diagnosis, an addiction diagnosis, or even something that's a physical diagnosis that they've had. And when they put that out there, that's information that the patient has, that they could do whatever they want with that. And knowing that I'm okay with, if they tell somebody else this or that or whatever. I think most people, and this again about knowing your patient, respect, like, I got a piece of information during this session to help me, I'm not going to take it elsewhere, but it's a risk. And so kind of being aware of that, that if I do that and I expose that, it's out there, it can be for, And so that's something just a consideration. I think that it connects back to just knowing the patient and knowing, who am I working with, and what's my past experience telling me about that. Does that help? Did I answer that question?
Yes, that's very helpful. Thank you. Do we have any other questions for Nelson? Or personal stories? I know.
Can you hear me?
Yeah. Hi, Dr. Darris.
Dr. Caceres. Just got a couple of comments, like how to come back from a hurtful experience. Say you share with somebody that perhaps, or not with somebody, but the patient, and actually was a real case, had a complication from coumarin toxicity. And then we had a lawsuit to my partner and I many years ago. So the partner left, and I stayed with the patient and taking care of patients with coumarin or patients that are not non-compliant, and had to overcome that fear of being in the same situation. Another example is like a patient that abuses your, narcotic prescription, and then goes out there and you caught him by doing that, and discharging the patient. Don't be afraid of taking care of those patients, how to overcome that negative experience and make it a positive one.
Sure. Well, I mean, you gave some good examples of that scenario. I think on the latter one, it's something I'm very familiar with too, is like you have this patient that you're working with, and they take advantage of something that you're trying to help them with, and you've caught them on that scenario, and how do I kind of not allow myself to work through that and not carry that negativity as I'm continuing to try to work with this person. That's really difficult too. But I think it's also about knowing the nature of the illness I'm dealing with as well, because that's addictions are, and I think this happens a lot. I mean, it's a rampant illness going on right now. That's the nature of this disease. That is almost the MO of what they will do. I mean, the patients that don't do that are, that aren't people that are struggling with addiction. If you're an addict, that's a symptom. So to me, one of the things when I'm addressing that, and it's interesting, I've had to go around to several lectures to talk about this with physicians and or medical students, saying you just need to talk about that illness, right? It just we need to talk about your disease of addiction. I mean, the narcotics and doing it. If I wanted to help you better, I just need to talk about this. We're not going to talk about like the pain stuff. You have an addiction issue. We need to address it. I don't know if pain medication is going to be part of that long-term solution or not, but this other thing is happening, and it's going to be hard to really get to that treatment of dealing with this other issue until that one's dealt with. And hopefully being able to say, I think that helps, I think as us, be able to say I was genuine with them, I did the right thing, I talked about it, and it lets some of that anxiety go, like I addressed the issue with them, I was kind of angry with them because they did this, but what I'm doing is I'm actually, instead of treating them like the problem that they did to me, like, this issue of like lying, I'm actually just going to recognize it's a symptom of this sickness, and I'm going to address them in that way. And it may help reduce some of my angst towards it, because I'm looking at it more like a sickness. The lawsuit's very, like dealing with somebody after that's got to be very complicated and a lot of emotional entanglement there. I've learned about forgiveness is an interesting thing. I remember reading when I was doing some groups on forgiveness, and they were talking to this, I forget what book it was, but I was reading this book, and there was this quote from this person that was a survivor of the concentration camps, and and they lost all their family, and there was nobody, like nobody's there left for them. And the person said, "You must be so angry at the Germans and Nazis for this experience." He goes, No, I'm not. Now, how can that be? It's like, because if I still remain angry at them, they're winning. And I thought, well, what a powerful statement that is. And so one of the things I've learned is I can protect myself, I can guard myself from things, but I also need not to allow myself to carry that negative emotion, because that negative emotion means that the situation's still getting free run in my head, and I don't want that. And so forgiveness is really, and I think forgiveness is a practice thing, not a just an instinctual thing. We have to work at that, because I think instinctually we want to protect ourselves. But forgiveness is like this thing of vulnerability. Because if I'm vulnerable and saying, I forgive you, I mean, I'm actually not, it may help them, but it's certainly helping me, And I don't know if that helps or not, because I don't know the specifics of the scenario, but just in general thought of vulnerability and forgiveness.
Yes, but letting go also.
Yeah, absolutely. Yeah, which is control. You know, like you can't change it, so why am I holding on to it?
Okay, thank you.
Mhm.
Questions?
Nelson, I know for sure that we have at least one residency group,
Mhm.
and curious if you have any good advice for residents in training that may feel especially vulnerable, not only to patients, but through their training process and faculty that are mentoring them. Any good
Yeah.
advice for these young physicians?
Yeah, well, first of all, good luck. You know, you're working a million hours and getting overwhelmed and not getting paid very much. So good luck with all that. Yeah, I think my experience actually is that I've actually probably more phone calls a month to me come from residents than come from like actually fully licensed physicians, because of all the stress and all the challenges they're facing, and like not feeling like they can be human. You're in an overwhelming position right now. Your work demands are high, your work schedules are crazy, you got people kind of scrutinizing things that you're doing, and it's hard, and it's a really one of those things where I think that I experience a lot of stress, a lot of burnout, a lot of people doing unhealthy behaviors to relieve that stuff. If it's acting out in one way or the other. Obviously chemicals is one of those ways, but it can be in other ways I've had it dealt with. And so I would say is, and we talked about it in one of the slides when we were talking about vulnerability. Well, the thing about it is ask for help, say that you're overwhelmed, say that you're challenged, be genuine, be real. People get fearful of like, I'm not going to say that I'm overwhelmed or I'm struggling or I'm stressed out because it'll be perceived that I'm weak. And I'm at a point right now where I'm so competitive, I don't want to look that way. But then if you get burnt out, washed out, or get in trouble in some other direction, then what was the point of all of it? And so I would encourage people, if you're feeling that way, if you're feeling stressed, and how do you deal with this? I guess I'm looking at more the vulnerability of being in that position, because there are so many demands going on, to be able to ask for help. Now, right, it's also complicated. It's like you're just learning. I mean, that's where they're, in your residency, you're really hitting the rubber hits the road, and you're having experiences when you're connecting with patients. And I think that's a really tough place. I remember when I was doing my counseling training, we were told very distinctly, do not self-disclose anything. It says you're treating this all very clinical, and you're coming at it that way. And that was a very difficult thing, because it was like, I'm just feeling very textbook about things and not being able to connect in a human way. And I think that's a challenge when we're starting this experience. And I think there's some wisdom to that, because you need to know the basics initially, but I think there is a point where I have to start learning too about when is it okay to like give some of myself to this patient, especially when I can see that I have something that I could offer them that would push them further and motivate them. And I think that's where things like why we have people that are supervisors and teachers that can guide us and kind of double check that and get some feedback about, is this appropriate time? Does this make sense? This is what I was thinking. Does that, and it may be an interesting question, because I'm not thinking about what's the medication or what's the diagnosis. I'm actually thinking, here's something I'm thinking about, how I'm trying to want to connect more human with this person, and I think it'll help motivate them to be more compliant. And I think it's an important medical question. Like, I think that piece right there, it maybe is equally as important as any pill I could give somebody. Because if I can't get them to a place where they feel like this trustworthy, this issue is real, then I don't know how I'm going to, what's good is knowing the stuff if they're not willing to do it, So, I mean, I hope that's okay. I mean, but it's hard. I mean, I don't envy the residents. I work with a lot of them, and I'm like, man, I don't know how you do it, so.
Well, wonderful. Are there any last questions for Nelson? Dr. Boltry, you always have a good question or comment.
I missed the first 10 minutes or so, and you might have defined vulnerability.
I think you say it makes the first 10 minutes.
Oh, okay.
And so if this question is redundant, I apologize. It seems like when you're sharing with patients, you're not really sharing vulnerability as much as frailty, human frailty, or your personal frailty. But
It's interesting.
Maybe I have the definition wrong. Vulnerability is sort of a feeling that you're going to be hurt by something.
Sure.
As opposed to having been hurt. I'm just
sure.
Because I teach students and residents, and so I want to make sure I understood And I'm sorry I missed the first 10 minutes.
Yeah. Well, we absolutely. I think that's a great point that you brought, and I think hearing most of what you kind of said there. I think that actually the first slide I kind of put up there was exactly what you're saying, that these definitions of what vulnerability means. I think I have to get it in front of me, but this whole idea of vulnerability is essentially, we're susceptible to physical harm, emotional harm, or susceptible to attack, in like this kind of, in this moment that I'm at. And so I think one of the things I was trying to do with this thing was kind of look at this when we talk about vulnerability is kind of, it is those things. It is this risk that we take, that we could be under attack, we could be emotionally vulnerable, it could be physically harmed or hurt. But the point is that I think what I'm trying to get with this kind of power about vulnerability kind of presentation was, if we don't do that, then we won't experience also joy. We won't experience connection. And to me, like, there's the two sides of the coin of vulnerability. Like, we get stuck looking at the potential, like the weakness component of it, as compared to, by taking that risk, I may actually get a reward that would be unknown. But if I'm fearful of taking that, because I'm fearful of that being attacked or whatever it is, then I will never know if I got this experience that was there. And I think that's kind of what we're saying is, from this presentation was, I'm willing to take risks that I would normally do, just so, and especially as a physician, to help them move forward, but say, like, it's okay that I'm actually showing my humanness, that it's okay. And it's okay if they don't accept that, but I'm going to, because I think that's an important piece of medicine, is being able to connect on that human level, especially family physician medicine, where we have long-term relationships with people. I don't know if that kind of clarified, but I did kind of talk about that initially. Yeah.
It did. Thank you.